have Rapid Diagnostic System, specializes again in healthcare and biotech, and the team is from Israel. All right, Rapid Diagnostic System, remember to share your presentation once you got into the stage.
Okay, good morning. Here is an early morning. So I'm on first. I'm the co-founder of Rapid Diagnostics, and our product is NAOR, the isothermal detection. We do non-lab molecular diagnostics for non-lab settings using RT lamp and some innovations some tweaks that we added to it. A little bit about myself and my partner. So I'm a former faculty member at both Columbia Business School and Yale School of Management, entrepreneur in the medtech space for the past 25 years. My co-founders are Professor Naama Geva and Professor Ezri Tarazi from the Technion. And we started with a clinical evidence, clinical study that was conducted at the Technion. And that was improved and enhanced with some innovations related to the flow, the workflow of the technology with devices that we added to an already known biochemical process called RT-LAMP, which is an equivalent to the traditional PCR, but which allowed us to do a saliva-based testing on-prem. That is, to do the analysis rather than in a centralized location, to do it on the premises. We've been awarded with multiple awards for the studies and the innovations, multiple patents that were filed. Great results. I mean, very equivalent, highly equivalent to a traditional PCR, but with very inexpensive infrastructure in the field. We received a CE mark for the technology. We've been supported by the Israeli Ministry of Defense from the get-go, and it was field tested in both Israel and in India in very large-scale clinical studies, and it's in process of being commercialized. The platform, it's important to note that within 40 minutes from start to finish, we have results online with the users and with alerts with patients, and as well as alerts to the ministries of the relevant ministries if needed, as needed. It is in a platform that is applicable for other targets. We started with COVID-19, but it's applicable to pretty much anything that has, that has an RNA effectively, and that was sequenced. So rather than have expensive infrastructure, rather than have collection tools and that are sophisticated and painful, and rather than have like a highly experienced team for collection of samples and processing the samples, we essentially shrunk it down to a very lean process, whereby after grabbing the saliva sample and heating it for 10 minutes on premises with very inexpensive off-the-shelf equipment, after these 10 minutes, you put it in another reaction mix for 30 minutes and receive results. We can have two tools. One device that we have allows all the entire process to be conducted on a small, all-inclusive device, or to use a regular traditional PCR tubes with very efficient and safe mechanism that we devised. We're shrinking the entire equipment that would otherwise would be typically tens of, or if not hundreds of thousands of dollars in labs, if not millions, into what could cost $30 for a very small scale that still can accommodate 96 samples every 40 minutes, or effectively we call it an hour, but it's less than an hour. And for with standard lab ovens of $1,000, you can serve like 500 samples in parallel with this innovative process, which is extremely quick and low cost. One example that we conducted is at the Technion. We used it on campus with faculty and students, thousands of students, hundreds of faculties, all using low-level personnel to manage the process with online forms, everything with QR code, everything is built in. It's a combination of the device and the workflow. You receive all messages online, as well as SMSs for the process. It was conducted with, as I mentioned, large-scale studies before. We've been used also on TV studios in Israel, which essentially allowed during the COVID blockade, we allowed a large festival to be conducted completely with hundreds of people on the staff in a very secured perimeter at very high scale. At that point, 1,000 tests within 4 days with no personnel whatsoever. With
Okay,
that, I
thank
can
you.
address some.